The ACA Employer Mandate. To understand the impacts of the 2015-2016 employer mandates on an employer's business, you must begin by determining the FTE. In 2015, if your company has fewer than 100 FTE, or in 2016 fewer than 50 FTE, then you do not fall under the employer mandate, are not required to offer your employees insurance coverage, and are not subject to the ACA employer penalties. Now, assuming that you do have an FTE of 100 or more in 2015, or 50 or more going into 2016, it is important that you understand all aspects of the ACA employer mandate. First of all, under these FTE scenarios, you will be required to offer insurance coverage to all of your eligible full-time employees, those working 30 or more hours per week. If you fail to provide coverage to at least 95% of your eligible employees in 2016, you will have to pay a penalty of $2,000 per eligible employee, excluding the first 30. This is different from 2015, where you can exclude the first 80 full-time employees. Now, in addition to providing coverage to all of your eligible employees, you must also extend this coverage to all eligible dependents up to the age of 26. Once a dependent turns 26, you are not required to offer them coverage. In addition, spouses are not considered dependents. Now, in terms of the insurance coverage that you actually offer, if you have 100 or more FTE, you must ensure that the coverage provides your employees and their dependents minimum value. Minimum value means that the insurance you provide to employees will, on average, cover at least 60% of the employee's expected medical expenses, not including the actual insurance premiums. This is also referred to as a 60% actuarial value, and if you do not meet this, you will be penalized as if you offered no coverage at all. If, however, you have 50 to 99 FTE in 2016, you may find that you are expected to provide insurance coverage that now aligns with the essential health benefits requirements and pricing structure of the health exchanges. In many instances, you could see a significant change in your plan design and your cost. Please know that there are states that plan to extend the transition to these metal-rated plans beyond 2016. Finally, if you do exceed the FTE threshold in 2015 or 2016 and are offering insurance to your employees and their dependents, the insurance must also be affordable. The ACA defines affordable insurance as insurance where the cost of an employee to access employee-only coverage is not greater than 9.5% of the employee's household income. Now, of course, most employers have no idea about an employee's household income. So as a safe harbor, the IRS has offered guidance that employers can simply use the employee's actual salary to calculate affordability. Regardless, if you offer coverage that is not affordable and one or more of your employees qualifies for subsidies on the exchange, then you will pay a $3,000 penalty for each instance. On a final note, before you start making health insurance decisions based on these mandates or the risk of penalties, please take a minute to weigh the options. It's important that you understand the big picture of ACA and its impact on your business and your employees. In many cases, choices, like avoiding all penalties or dropping all coverage, are not in the best interest of the employer or the employees. Remember that knowing the rules, knowing your employees, setting your priorities, and assessing your options is ultimately the process by which employers can make the best choice.